morning everyone, I am Aaleha Izza Baliwan and now I am going to do a return demonstration for Leopold'S maneuver. So now, just like anything else, I am gonna wash or sanitize my hands to prevent the spread of infection. So after that, I am gonna provide patient privacy. So I already closed the door and the window to minimize the embarrassment of the patient. So next is I am going to identify my patient and explain the procedure to her. So good morning ma'am. I am Aaleha Izza Baliwan and I will be your student nurse for today. So now I am going to perform Leopold'S maneuver, which means that I am going to place my hands into your stomach. So would that be okay for you, ma'am?
Yes.
Okay, after that, after identifying and explaining to the patient, I am gonna make sure that she emptied her bladder, and then I am going to make sure that she is placed in a flat position, but then I am going to put a little, or will lift her lift her hip a little so that she is not that into a very flat position. So I already placed it, and then now for the first maneuver, I am going to face the mother's head or the mother's face, and then now I am going to make a triangle with my hand, and then I am going to put it or place it into the stomach of the mother, and then I am going to feel for the head and the bottom of the baby. So the head of the baby feels round and hard, while the bottom of the baby feels squishy and tiny. So after that, for the second maneuver, I am going to place both sides, my hands into the both sides of the stomach of the mother to feel the back of the baby. So now I'm going to put my hand, so the other hand is staying steady, while the other is the one that is moving, and then I am going to do it on the other side. So again, the other side for steady and the other side for the moving. So knowing for this is important. So knowing the back of the baby is important because that is where we can get we can put the heart rate monitor, because that will be the most, or the baby's back is the most accurate in getting the heart rate tracing of the baby. So now for the third maneuver, I am going to make an L shape with my hand, and for the third maneuver, I am going to identify if the baby is engaged or not. So with my hand, I'm going to put it or place it here, then closer to the symphysis pubis, and then we feel if the head of the baby, if we can lift the head of the baby or not. If we cannot lift the head of the baby, then the baby is engaged. And if we can lift the baby's head, then the baby is not engaged. And then, after that, for the fourth maneuver, or the last step of the Leopold'S maneuver, is that I am going to face the mother's feet, and then I'm going to face the mother's feet, and then I am going to place my hands here, and I am going to move it from bottom to up to know the position of the baby.
Go.
So this is to verify the position of the baby. So after that, after performing the Leopold'S maneuver, we are going to cover the mother, and later we can put the heart rate monitor, and after that we're good to go. So now I am going to put the details or the information into my notes. And then for the age of gestation or the AOG, the mother is 28 weeks pregnant, and for the EDC or the expected date of confinement is December 13, 2021. So after that, now I am going to thank my patient. So, ma'am, thank you for your cooperation, ma'am.
Okay.
So, now that would be all for my return demonstration for Leopold's maneuver. So, thanks for watching.